Irregular periods are a common concern for many women. They can be a sign of an underlying health condition, or they may be nothing to worry about. It is important to understand what irregular periods are and what causes them, so that you can take steps to manage them. A regular menstrual cycle lasts between 21 and 35 days. This means that the time between the first day of one period and the first day of the next period is between 21 and 35 days. Most women have a period every 28 days, but it is normal for this to vary slightly. Irregular periods are periods that occur outside of this normal range. They may be shorter or longer than usual, or they may be heavier or lighter. Some women may also experience spotting between periods or miss periods altogether. There are many different causes of irregular periods. Some common causes include stress, weight loss or gain, polycystic ovary syndrome, and thyroid problems. If you are concerned about irregular periods, it is important to see your doctor to rule out any underlying medical conditions. Irregular periods can manifest in several ways, causing disruption to a woman's life and raising concerns about her reproductive health. Understanding the common symptoms of irregular periods is crucial for early detection and seeking appropriate medical advice. One of the most noticeable signs is an inconsistent cycle length. While a normal menstrual cycle typically ranges from 21 to 35 days, women with irregular periods might experience cycles shorter than 21 days or longer than 35 days. This inconsistency can make it difficult to track ovulation and plan for pregnancy. Variations in menstrual flow and duration are also common symptoms. Some women might notice unusually heavy bleeding, soaking through pads or tampons rapidly, while others might experience unusually light bleeding. Similarly, the duration of the period can fluctuate, with some periods lasting longer than 7 days. Spotting or bleeding between periods, known as intermenstrual bleeding, can also be a sign of irregular periods. This bleeding is usually lighter than a regular period but can be alarming. Additionally, some women experience amenorrhea, which is the absence of periods for 3 or more consecutive months. Amenorrhea can have various causes, including pregnancy, hormonal imbalances, and certain medical conditions. Our lifestyle choices can significantly impact our menstrual cycles. Factors like stress, diet, and exercise play a crucial role in maintaining hormonal balance, which directly affects the regularity of periods. Understanding how these factors influence our menstrual health empowers us to make informed decisions and adopt healthier habits. High levels of stress, a common experience in today's fast-paced world, can disrupt the delicate hormonal balance within the body. When we're stressed, our bodies release cortisol, a hormone that can interfere with the production of estrogen and progesterone, the two hormones responsible for regulating the menstrual cycle. Similarly, extreme weight fluctuations, whether due to rapid weight loss or gain, can disrupt the endocrine system responsible for hormone production. When the body undergoes significant weight changes, it can affect the production of estrogen, potentially leading to irregular periods. Maintaining a healthy weight through a balanced diet and regular exercise is essential for hormonal equilibrium and menstrual regularity. Strenuous exercise, while beneficial for overall health, can also impact menstrual cycles, especially if the body is not adequately nourished or rested. Excessive exercise without proper calorie intake can put the body under stress, leading to hormonal imbalances that manifest as irregular periods. Hormones are the body's chemical messengers, and they play a crucial role in regulating the menstrual cycle. Fluctuations in hormone levels can significantly impact the timing, duration, and flow of periods. Understanding hormonal influences is essential for identifying imbalances and seeking treatment. Hormonal contraception like pills, patches, rings, injections, and IUDs alter hormone levels to prevent pregnancy. These methods can cause temporary irregularities, especially initially. Certain medications like steroids and anticoagulants can also affect menstruation. Discuss any medications with your doctor to understand their effects on your cycle. Conditions like polycystic ovary syndrome can disrupt ovulation and cause irregular periods. Section 5: Life Stages and Menstrual Irregularities. Throughout a woman's life, her menstrual cycle undergoes various changes influenced by different life stages. From puberty to menopause, these transitions bring about hormonal shifts that can affect the regularity and characteristics of periods. Understanding these changes is crucial for women to recognize what's normal and seek medical advice when necessary. Puberty marks the beginning of a woman's reproductive years, and during this time, irregular periods are common. As the body adjusts to the surge in hormone production, it's typical for girls to experience irregular cycles, variations in flow, and even missed periods during the first few years after menstruation begins. After childbirth, women experience significant hormonal fluctuations as their bodies return to their pre-pregnancy state. During the postpartum period, irregular periods are common, and it may take several months for the menstrual cycle to regulate. Breastfeeding can also influence hormone levels and delay the return of periods, but this is a normal physiological response. Perimenopause, the transitional phase leading up to menopause, is another life stage often associated with irregular periods. As women approach menopause, their ovaries gradually produce less estrogen, leading to hormonal fluctuations that manifest as irregular cycles, changes in flow, and other menopausal symptoms like hot flashes and night sweats. Section 6. Medical conditions and irregular periods. Medical conditions can disrupt the menstrual cycle. Polycystic ovary syndrome, or PCOS, is a leading cause of irregular periods. PCOS disrupts ovulation, causing hormonal imbalances. Symptoms include acne, excess hair growth, and weight gain. Thyroid disorders also impact menstrual regularity. Hypothyroidism causes heavier periods. Hyperthyroidism causes lighter periods. Uterine fibroids and polyps can cause heavy bleeding and irregular periods. Section 7. Diagnosing and treating irregular periods. Diagnosing the underlying cause of irregular periods is crucial for determining the most effective treatment plan. Healthcare providers typically begin with a thorough medical history, including the frequency, duration, and flow of periods, as well as any other accompanying symptoms. A physical examination, including a pelvic exam, might be conducted to assess reproductive health. To further investigate the cause, healthcare providers might recommend blood tests to check hormone levels, including estrogen, progesterone, thyroid hormones, and testosterone. Imaging tests such as pelvic ultrasounds can help visualize the reproductive organs and detect any abnormalities like cysts, fibroids, or polyps. Treatment for irregular periods varies depending on the underlying cause. For hormonal imbalances, hormonal treatments like birth control pills, patches, rings, or hormonal IUDs might be recommended to regulate the menstrual cycle. Medications like metformin can be prescribed for PCOS-related irregularities to improve insulin sensitivity and regulate ovulation. In cases of uterine conditions like fibroids or polyps, surgical options might be considered. Myomectomy, a surgical procedure to remove fibroids, or endometrial ablation, a procedure that removes or destroys the uterine lining, can reduce heavy bleeding and regulate periods. Uterine artery embolization, a minimally invasive procedure that blocks blood flow to fibroids, can also be an effective treatment option. Section 8. Self-care tips for menstrual health. While medical intervention might be necessary in some cases, certain self-care practices can significantly improve menstrual health and regulate periods naturally. Adopting a holistic approach that addresses both physical and mental well-being can promote hormonal balance and support a healthy menstrual cycle. Maintaining a balanced diet rich in fruits, vegetables, whole grains, and lean protein provides the body with essential nutrients for optimal hormone production. Limiting processed foods, sugary drinks, and unhealthy fats can help regulate blood sugar levels and reduce inflammation, contributing to hormonal balance. Stress management through relaxation techniques like yoga, meditation, deep breathing exercises, or spending time in nature can significantly impact menstrual health. Chronic stress disrupts hormonal balance, while relaxation techniques help reduce cortisol levels, promoting hormonal equilibrium and regular periods. Ensuring adequate sleep is crucial for hormone regulation. During sleep, the body repairs and rejuvenates itself, and hormone production is at its peak. Aim for 7 to 9 hours of quality sleep each night to support hormonal balance and overall well-being. Section 9. When to consult a doctor and importance of tracking. While occasional irregularities are common, certain signs warrant medical attention. Consult a healthcare provider if you experience the following: absence of periods for 3 or more months, fewer than 9 periods in a year, or no period by ages 16 to 17, bleeding between periods or after sex, significant changes in flow, or severe pain. Tracking your cycle helps monitor health and identify irregularities. Understanding your cycle empowers you to take control of your reproductive health.